Hi everybody, Dr. Manson and classmates in evidence-based treatments at Ryokan College. I'm going to present a brief PowerPoint presentation for you on dialectical behavioral therapy for borderline personality disorder. Dialectical behavioral therapy, or DBT, is a research-based, evidence-based treatment for BPD. Going back a couple of decades now, there's a pretty robust research base supporting its efficacy. It's a rather unique cognitive behavioral therapy in its focus on dialectical principles, a dialectical worldview, and utilizing Buddhist principles such as mindfulness. It also includes classic CBT techniques like thought diaries, exposure techniques, shaping, behavioral analyses, and so forth. Borderline personality disorder, or BPD, has historically been very difficult to treat, essentially as it entails several areas of key and often severe dysregulation, primarily emotional dysregulation, but also interpersonal, behavioral, cognitive, and dysregulation of the self. And DBT is effective and also liked by clinicians because it has a manual. It's a manual-supported treatment protocol. The research base, as I mentioned a moment ago, supporting DBT as evidence-based and efficacious for BPD is quite robust, and many studies going back 20, 25 years have shown that DBT has significantly reduced hopelessness, depression, anger, suicidal and parasuicidal behavior, dissociation, inpatient hospital stays at 4, 8, and 12 months post-treatment, with clients reporting better social adjustment and higher global functioning. Other studies have shown significant decreases in self-harm, dissociative experiences, depressive symptoms, suicidal ideation, and impulsivity. And in suicidal adolescents, studies have shown fewer psychiatric symptoms, less suicidal ideation, and fewer symptoms of BPD. A meta-analysis from just this year, 2014, showed DBT is effective in stabilizing patients, controlling self-destructive behaviors, and improving patient treatment compliance. Some of the key components of DBT for BPD are, as I mentioned a moment ago, a focus on dialectics. Essentially, a synthesis of extremes is what we're shooting for. Two of the classic ones with DBT are wise mind, which is an integration or a synthesis, a balance of our rational, logical mind with our emotional self, our emotional being, and acceptance versus change. That's probably the core dialectic in DBT. Accepting oneself, helping clients accept themselves and accepting them, communicating that acceptance to them, while at the same time motivating them and encouraging them to change, which is really what life is all about. It's constant change. As I mentioned before as well, there are classic cognitive behavioral therapy principles like cognitive restructuring and modification, exposure, behavior analysis, skills training, and much more. The skills training is a really core and important part of DBT, and there are essentially 4 key core modules: mindfulness, distress tolerance, emotion regulation, and interpersonal effectiveness. Focus on mindfulness is really teaching clients to have a non-judgmental awareness and acceptance of moment-to-moment reality, the feelings and thoughts primarily, but also really reality overall. Other key concepts in DBT are validation, problem-solving strategies, and contingency procedures. And typically modalities include individual therapy each week, group skills training with a different clinician each week, and then frequent consultation for clinicians, and phone contact with clients, really basically possibly 24/7. Obviously there have to be limits, and that's part of the treatment is working that out with clients so that it doesn't become a therapy interfering behavior, which is another focus of DBT, reducing therapy interfering behaviors. A few examples of skills module interventions. DBT, by the way, is quite fond of acronyms to help people, clinicians and clients, remember some of these skill groups. Mindfulness involves what and how skills, observing, describing, and participating, as well as the non-judgmental stance we mentioned before and being focused on just one activity in the present moment. FAST stands for example, in interpersonal effectiveness skills, a focus on self-respect in relationship. FAST standing for being fair to oneself and others, not being apologetic for one's opinions and feelings, sticking to one's values, and being truthful and accountable. Emotion regulation really involves a focus on identifying and labeling current emotions and balancing mental and physical health, as well as using mindfulness, focusing on positive emotional events and so forth. And finally, distress tolerance. The two of the main skill groups with the distress tolerance module are distraction, and there's literally dozens, if not hundreds, of ways people can distract through activities, through contributions, those are the first two letters of the acronym ACCEPTS, and through self-soothing. Self-soothing often through the senses, learning to use olfactory, auditory, gustatory, taste, all kinds of different ways to focus on the senses, get into the current moment, and distract from distress as a way of learning how to cope with it. In conclusion, DBT has been shown to be a very effective evidence-based treatment for borderline personality disorder, and because it's been so effective and manual-based, many clinicians have taken it and been effective with a very difficult client population. Many clinicians have used it for other populations and other disorders, and it has shown some promise in the treatment of substance abuse, depression in the elderly, eating disorders, suicidal college students, mentally disordered offenders, and more. However, the research base is not as robust with these populations, and it's clear that further research is necessary. So thank you very much, and I hope that this presentation has been helpful.